Hi, What the HealthTech listeners. I'm your host this week, Justine Abson. This is the podcast where we tackle some of the trending topics, ideas, and best practices across health and social care. This week, I'm speaking to Sarah Graham. Sarah is an award-winning freelance health journalist and author of Rebel Bodies, A Guide to the Gender Health Gap Revolution, and is also founder of the Hysterical Women blog, specialising in health, gender, and feminism. She's written extensively on these subjects for the newspaper, Refinery 29, The Telegraph, Grazia, The Guardian, the British Medical Journal, and many others. She was also a finalist in the 2021 Medical Journalist Association Awards. Sarah, that's quite a bio. Welcome to the podcast.
Thank you for having me.
So I'm really excited to see you here today. So I first saw you when I came along to a session you held as part of the York Festival Ideas this summer. And I was absolutely blown away by some of the topics and statistics that you talked about, which are part of your book, which I've got here, Rebel Bodies, A Guide to the Health Gap Revolution. There's so much to talk about in this book. I mean, it covers everything from politics and healthcare to gaslighting, misdiagnosis, and the research that shows there are still such big differences when it comes to men and women's health. So how did you first get into writing on topics covering health, gender, and feminism?
So, yeah, it's a really good question. I mean, when I first started out as a journalist, I was writing quite broadly on sort of women's issues. You know, I'd got very interested in feminism as a student. But I guess I found that the ones that I was kind of most drawn to, the more I went along, were around health, particularly interested in mental health, sexual and reproductive health, and debates around kind of reproductive rights, the battle for abortion rights, particularly in the US, but equally in the UK. And so when I went freelance, then that was kind of the obvious area for me to focus on. And yeah, the more I wrote about it, the more I kind of found that I was pulling at threads and just going further and further down this path, looking into the gender health gap and getting more and more frustrated and annoyed about the things that I was finding.
I think that's it, isn't it? There's so many, I mean, obviously having read it as well, there are so many little things that kind of come out of it and things that you wouldn't normally think about. And I think the point you just made about, unraveling the thread almost from everything you kind of touch upon, I can imagine there is such a rabbit hole of every little thing that is so easy to fall down.
Oh yeah, totally. And there are things that I could have included in the book that I didn't have, but I'm sure I've crammed a lot into the book. It covers loads and loads of different subjects, but there were so many more that could also have been in there. And even things that I've written about since writing the book, and I've thought, oh, I wish I'd thought to include that. I wish I'd thought to include this. And it just seeps into so much of the healthcare that women experience.
Yeah, definitely. So, I mean, that brings me really nicely on to sort of what prompted the book to be written, and what do you hope people can gain from it, and what can we all do to help bridge that gender gap that is there in healthcare?
Yeah, so the book obviously came out of my blog, Hysterical Women, which in turn, I suppose, had come out of the work that I was doing as a freelance journalist. So I was frustrated that I was hearing lots of very similar stories from women I was interviewing, whether we were talking about endometriosis, the menopause, chronic illnesses, all sorts of different topics. People were saying, I feel like I was dismissed by my doctor. I feel like I wasn't taken seriously. I wasn't believed. And the really striking thing about that was that I was having so many of these conversations, but virtually every single one of these women said, I feel like it's just me. I feel like I'm weak, like everyone else is coping with this, and there's just something wrong with me, and I feel so isolated and alone. And so that prompted me to start the blog, basically to say to them, you're not alone. Like, there are all of these other women experiencing these things. This is a systemic issue. There's a lot more going on here. And it was during the pandemic that I kind of finally decided to pull it all together into a book, really. I'd always had the idea of a book in the back of my mind, but the pandemic was such a kind of pivotal time in terms of the way that we were all thinking about health and healthcare, and particularly health inequalities, looking at the people that were affected by COVID the most. And so what I wanted to do with the book was to take lots of the stories from the blog, but put them all into context, explore why is this happening, but also to really celebrate some of the activism, some of the patient advocacy that I had discovered through the process of pulling this blog together for the previous 2 years. So it was about wanting to kind of pull all of those threads together and present it in a way that I hope, lays out what some of the problems are, but hopefully also presents a bit of optimism as well, so that people don't come away from it feeling like complete and utter despair, which is easy to do, with these subjects. But I think, we have seen such progress in the last few years as well that I didn't want the book not to include all of those positive sides as well.
I think from my point of view, it definitely comes across like that. I think it's really interesting what you touched on about obviously health inequalities, because they actually come across in every single subject that I think is almost in there, with people suffering in different ways. But I think that there is an element of that optimism. I think it's that sort of, like you touched on, the women kind of just think it's just them or suffer in silence a little bit. And I think when you see so many things out there that actually this has happened to hundreds, thousands, millions of other women, then it sort of does make you go, all right, okay, that isn't just me that feels like that or felt like that. So I think there probably is that optimism bit there that's definitely a good thing to take away from it.
Yeah, no, absolutely. And, I was having this conversation with somebody yesterday. A lot of the time, I've been having these conversations for a few years now, and a lot of the time it feels like, we're so socialized as women to not make a fuss, just be a good girl and get on with it and don't complain. And, you know, it feels like once one person is kind of brave enough to, stick their head above the parapet and go, actually, this happened to me and it really wasn't okay, and I'm not going to stand for it. The outpouring and this kind of avalanche of women opening up about their own experiences, and it's almost like they've been given permission to go, oh god, yeah. And it's such a relief. And people are constantly coming up to me at events even and saying, this happened to me, let me tell you about my experience. And I think that kind of catharsis is something that I really hope people can take away from the book as well.
Yeah, it's true. I mean, that, even when it comes down to things like miscarriage, IVF, again, it's the same sort of situation, I think, that you see as well. And I'm sure, there's so many women that have come across this in groups of friends and things, where once somebody has said that they've gone through that, there might be, 3 or 4 other people that have gone, actually, that happened to me a few years ago. And, I just didn't feel comfortable about saying it, or whatever it might be. So I think that is still something that, there's an element of actually speaking up, which is a really positive thing for others as well.
Yeah, absolutely. And I think, there are lots of problems with social media, and particularly in the kind of health and wellness space. But I think that is one of the real positives, is that kind of community, and the way that platforms like Instagram and TikTok allow people to feel able to speak out about these experiences and build communities of like-minded people who are going through the same things, when, perhaps the people in their own everyday lives don't necessarily understand what they're going through.
Yeah, definitely. I mean, we've got to talk about some of the stats that are in the book. There are obviously quite a lot in there, but some of the ones that really stood out to me were that 14 million working days a year are being lost to the menopause. Endometriosis costs the UK economy 8.2 billion a year, and more than 50% of young women experience period pain bad enough to need medication. Yet a 2020 study into gender disparities in health research funding highlighted that endometriosis and other female-dominant conditions are among some of the worst funded by the US National Institutes of Health, while health issues that predominantly affect men are overfunded. What's your thoughts on why this is, and do you see this changing as we continue, or do you think there's still a risk of this being the case in the next 10, 20, 50 years even?
I think it's really complex, and I feel like there's such a lot of catching up to do. It's, I talk in the book about the fact that there are so many research gaps, it's kind of impossible to know where to start really in terms of closing them. But I think, we have a healthcare system essentially that throughout history has been built by men for men, and so the focus has been on the issues that affected men. Historically, doctors, researchers, scientists have been mostly men, and so conditions that mostly affect women have been neglected, have been ignored. I think there's also a bit of an element, and I talk about this a lot in the book, in lots of different areas, where women's issues have been normalized. So there's this idea that periods are supposed to be painful. That's just what it's like. You just have to get used to that as a woman, and that is a really big thing, and it's something that we all internalize as well. Like I was saying, with that socialization, we kind of go, oh well, my mum put up with it, and my grandmother put up with it, and so I just have to put up with it. So I think that is a really big thing. And the other thing that has been spoken about more, I think, in the last few years, is this idea that a lot of these issues that we're talking about, endometriosis is a really good example, is considered a benign condition, right? It's not cancerous, it's not life-threatening, but and so as a result, it's not seen as a priority. It's not like, oh well, we're not going to save loads of people's lives by investing in research. It's not like cancer. It's not one of those big things that people, everyone is touched by someone who's been affected by cancer. But actually, the reality is, as you've said, is that these conditions are debilitating. They have a massive impact on people's quality of life. And even if as a government or as funders, you're not interested in people's quality of life, the economic impact is huge. In terms of 50% of the workforce are going through these types of issues. So in terms of like the future, I think things are changing really slowly. And I think to some extent that is inevitable just because of the size of the gap and the amount of catching up there is to do. I do think we're seeing some progress, and certainly it seems to be a little bit more on the agenda, but there's still not enough funding going into women's health. One of the professors that I interviewed about PCOS said that he has colleagues who, when they're applying for research funding to look into PCOS, they have to kind of wrap it up as like metabolic disorders rather than PCOS, because it's just seen as one of these like not very important women's things, of women and their ovaries. So I think there's still a huge amount of work to be done there, and I think really investment and getting to the people who make those funding decisions, the people who decide what's important, basically, those are the ones that we need to get to and to influence, because they are setting the agenda for what gets researched and what doesn't.
Yeah, definitely. One of the things that kind of really stood out to me was, when we talk about bridging the gender gap, I think people instantly think about women's health conditions in particular, such as those that are, menstrual related. But one of the things that really stood out was some of the statistics around heart disease. So the heart attack gender gap, which was published in 2019 as part of a wider research piece by the British Heart Foundation, estimated that more than 8,000 women in England and Wales died needlessly from heart attacks over a 10-year period. And that was purely because they'd not received the right care. They'd received worse care than men had. And it also showed that women are 50% more likely than men to receive an incorrect diagnosis whilst having a heart attack, whilst in fact coronary heart disease is the leading cause of death for women globally, killing twice as many women in the UK than breast cancer. That to me just massively stood out because it wasn't something I was aware of, and I'm sure there's so many people that are not aware of how important these conditions are. What do you think we need to do to bridge the gap when it comes to health conditions like these and ensure that treatment is equal no matter what gender you are or where you're being treated?
Yeah, it's a really interesting one, and actually for me, I guess that kind of, as you say, we do mostly talk about these kind of gynae or obstetric issues when we're talking about women's health. But actually, for me, in many ways, the most interesting ones are the ones that you think of as being kind of gender neutral, the ones that affect body parts that we all have, because that I think really shows up where the biases and inequalities are. It's one thing to just not care about one particular section of medicine, but if you've got a section of medicine that deals with patients from all walks of life, and some of them are being treated differently from others, that really kind of shows the extent of how big the problem is. And again, I think it's really complex. It's a really tricky one to kind of unravel, because there are so many different factors there, in terms of, the fact that research has mostly been done on men, and treatments have been tested on men, and but then, also you have all of those cultural things, like, it's not even just the fact that doctors mostly associate heart attacks with men, but actually we as women, as patients, don't necessarily think of ourselves as being the type of person that has a heart attack. So, one of the things you see is that women themselves present later in A&E when they're having a heart attack, because they almost kind of dismiss their own symptoms. And you then have that double whammy that once they get there, they're kept waiting longer, they're more likely to be misdiagnosed. And so that just drags on that process even longer. I think there's a really big kind of cultural and scientific change that needs to happen there, not just in cardiovascular health, but in all sorts of things, where we need the research to catch up. We need doctors to have a really good understanding of the differences, but actually also the similarities in terms of how these things present, and just to be much more aware, much more mindful of the way that they are treating people, the way that they're making decisions, the kind of stereotypes, I suppose, that they're relying on. If somebody presents with certain symptoms and they're a middle-aged man, are you more likely to go, oh yes, obviously a heart attack? Whereas if they're perhaps a slightly younger woman, your mind automatically goes, oh yes, anxiety, she's having a panic attack. So those kinds of mental shortcuts that, and doctors are under a lot of pressure, a lot of time constraints. They're having to make really quick snap judgments, but they need to be able to address how their biases are influencing those judgments as well.
I think it's a really important point you mentioned as well about actually people understanding their symptoms a little bit more, because I was chatting to some friends about these statistics around heart attacks in particular, and they instantly were like, oh, is that a thing? Like, how many women actually do have a heart attack and things like that? So I think you're right. I think there's probably a lot less, almost a lot less of people understanding what that means for them as well.
Yeah, absolutely. And I think you see it, a similar kind of thing in gynae cancers, for example. So we all know about breast cancer. I feel like, breast cancer has had this amazing kind of like branding campaign and awareness, and we all know to check our boobs at the start of the month, and we're all very comfortable talking about breast cancer because it's a kind of palatable discussion, whereas talking about vulvas and vaginas and even wombs and ovaries makes people a bit more uncomfortable, and it feels a bit more inappropriate and dirty, and you don't want to talk about it in front of your children. So, I think being aware of the fact that, breast cancer is not the only thing that kills women. It's not the only cancer that affects women, although it is the biggest, is such an important thing. And actually being able to talk about what's going on with our gynecological health, what's going on with, the whole of our bodies, not just kind of focusing in on particular parts that we're all kind of okay with talking about.
It's really interesting that, actually, and I'm going to touch on social media in a second, but I was at a women's conference a few months ago, and there was a social media influencer there who basically is all about educating, putting videos out there to educate young women and young girls about their bodies and about what's okay to say and what you should talk about and things like that. And I thought it was really interesting because, like we've just mentioned, people are more comfortable talking about one thing than others. And it was really interesting to see that she's actually putting herself out there to basically say, this is what you should do. And I'm gonna touch a bit on social media now. So yeah, I think there's a lot more awareness out there, which is obviously a good thing for people to be more open about talking about everything, not just, breast cancer or anything like that. But I mean, going back to social media, there's obviously a lot of informative content out there, which is absolutely fantastic. People have got a lot of access to research, to, people like that I've just mentioned that are, putting their knowledge forward to kind of encourage people to speak about things. But how can we make sure that the advice that we're reading is credible and helpful, rather than just maybe another expert who might not have the relevant credentials to be talking about certain topics?
It's a really tricky one to navigate, I think. There is so much information out there on social media, and actually filtering through all of that requires a degree of health literacy that we don't all have. I think the really key thing for me is always looking at who is this person, what are their credentials. There are some fantastic medical doctors now on social media, on platforms like Instagram, on TikTok, on Twitter. People like Dr. Nighat Arif, Dr. Aziza Sese, all sorts of amazing people who are sharing genuinely evidence-based, informative, useful content. I think if somebody is, perhaps not a medical expert, but has some lived experience as a patient, then they may have valuable things to share still. And I'm not saying by any means that doctors are the only experts we should be listening to, because as I say in my book, very often patients become the kind of experts in their field because their doctors don't have the relevant training and education. But thinking about the credibility of what they're saying, are there scientific studies to back it up? Are there other people saying the same thing? What's the price tag on what they're promoting? You shouldn't have to be spending hundreds or thousands of pounds on kind of miracle cures. And that's where I think it can get really tricky, because often if people are really desperate for symptom relief and they feel like they're not getting that support from their doctors, it can be very easy to be kind of drawn in by glossy branding on social media and influencers saying, try this, try that. So, looking at who is this person? What are their motives? What are they getting out of this? What experience and expertise do they have in order, to say that? And is there any kind of evidence, whether that is scientific research and papers and studies that back it up, or actually is there, a very long-standing and anecdotal evidence base saying that people have used this for generations and it does seem to have an impact. So yeah, I don't necessarily kind of wipe things out just on the basis of there not being scientific evidence, because we know there isn't enough scientific research in this area. But yeah, it can be really easy, I think, to be taken advantage of.
Yeah, I think there's some really good points there of things to look out for, to make sure that the information that you may be using is credible as well, which is great. What are your thoughts when it comes to data? So obviously, that we've got so much access to data now, so much more than our, parents, grandparents had anything like that. We've got smartwatches, we've got fitness devices. I think everybody I know has got something that holds data about themselves. So do you think that can help us to have more say over our own healthcare, and what can we be doing with that?
Yeah, I think it can be really useful. I think data, again, is a real kind of double-edged sword, where you need to be aware of who you're giving your data to and how they're using it, and what they're doing with that data. But I think, I'm a huge advocate of things like symptom tracking your menstrual cycle, being aware of what's going on within your body at any kind of given time in the month. And that's not just necessarily premenstrual symptoms, but understanding what's happening throughout the rest of your cycle can be really useful. Yeah, but equally, there are concerns about data privacy and anonymity, and how that data is being used, where I think you have to be a bit careful, again, at looking at what the companies that you're, the apps that you're using, the wearables that you're investing in, what are they doing with the data? How do they guarantee your privacy, your security, that your data isn't being sold to advertisers or whatever? Because I think actually, in a wider sense, if this data is used well, it can again have really positive benefits. There are period tracking apps who are using their users' data for women's health research, to fill some of these research gaps that we're talking about. And I'm more than happy to hand my data over to those kinds of companies where I know that it's going to be used for something positive, for something that is beneficial in terms of a kind of wider women's health. If it's just somebody that's going to, sell my data to advertisers so that I start getting Ben and Jerry's targeted ads every month, then I'm not okay with that.
We've chatted about we've mentioned the blog Hysterical Women a couple of times, which is all about women's health concerns that are not being taken seriously. And I think the fact that you've created a space which is inclusive for stories to be heard is fantastic. And how important is that in terms of, that exists and women don't feel like they are suffering in silence?
I think it's huge. I think that has been the real kind of power of it. I think it's so easy, even though we're in this like super connected world where everyone's on social media all of the time, it's so easy to feel like you are on your own and to feel like there's nothing that you can do. There's nothing you can say to challenge your doctor's opinion, that you don't have any power. And that was what I really hope the book does more than anything, is to, I kind of hate the word empower because I feel like it's overused, but I do want to empower women to go, this isn't just me and it's not my fault that I'm treated this way. It's not anything I've done wrong. I'm not just being weak. One of the women that I remember interviewing, who'd had a hysteroscopy a few years ago and experienced absolutely agonizing pain. And she said she went away and she blamed herself. She felt like she was just weak and everyone else coped with it fine because her doctors had said, oh, you just need to take an ibuprofen beforehand and you'll be fine. And I think that feeling is so, so damaging, and it affects our ability to advocate for ourselves, and it affects the way that we feel about ourselves. And so I think, yeah, for me, that was the most important thing, really, was for people to come away feeling like whatever happens, it's not my fault. I didn't do anything wrong. And, it's not necessarily my doctor's fault either, because these are big systemic issues. In some cases, I think doctors are personally at fault, but I think actually in a lot of cases, they are just as much constrained by the system, and struggling and trying to do their best. But yeah, I really, for me, that it's still the most important part of my work, I think, is sharing people's stories so that other people who are going through the same thing can perhaps find answers or find some sort of resolution.
I think as well, just going back to your point about, just so people don't feel like they're on their own as well, is such a huge thing. I mean, you start the book talking about, years ago and women kind of the hysteria side of it, almost of what they used to kind of get almost tarnished with, because they might have been going through the menopause or another, something else. And I think actually having that sort of that channel or that outlet or somewhere that, if it means that somebody can read something and go, actually, that it's normal, it's not something that's odd, is massive.
Yeah, totally. I think that's so important. It's human nature, isn't it, to want to feel like we're part of something bigger. So yeah, knowing that other people are going through the same things, that what you're experiencing is not a reflection on you as a person, but also that there are solutions, and even if there aren't solutions, that there are other people who've kind of got your back and who are fighting to make things better for you, and they're just kind of in solidarity, whether that's to hold your hand and give you a hug and go, yes, it's really crap, it's really awful, but I feel for you, is such a powerful thing as well, even if you don't necessarily have all of the answers or a kind of definitive way out.
Yeah, I mean, it's one thing I do think is really important to mention is, you are pro NHS, and the book, the blog, etc. They're not written to hit out at overworked, under-resourced healthcare professionals. We've just touched on that in the last question. But it is there to highlight that there's a much higher level of medical sexism that holds women's healthcare back. What do you think we can do or all do to help make this better for women of the future?
I think continuing to speak out is the most important thing we can do. We have seen how big an impact that's already had, particularly I think around menstrual health and the menopause. When I first started writing about these issues 5-10 years ago, nobody was talking about these things. It was still such a taboo. My mum never spoke to me about the menopause until I started writing about the menopause, and then suddenly we were having these conversations that we'd never had before. So I think that is huge, and we know it's already had an impact politically. We had the first ever women's health strategy published by the government last summer. That would not have happened without the power of patient advocacy and patient voices and people speaking up and saying, we want this to be better. So I think in terms of kind of keeping the momentum up, that's the most important thing we can all do. Keep talking about these things. Keep educating our daughters, our sons, our partners, even our older relatives, our friends, people who perhaps aren't engaging in these conversations on social media in quite the same way. Just having these conversations and educating people and making it normal to talk about these things is huge. I think the other thing that we can all do is to support the NHS, to continue demanding better from the government for the NHS. So whether that is supporting strikers, decisions about who we vote for, perhaps, and looking at what we ask for from our political leaders, in terms of protecting the healthcare system that we all have and know and love, because we are so lucky to have it in the UK, and it would be devastating to lose it.
Yeah, I think that's a really important point. That I think it is something we're extremely lucky to have, that a lot of other countries don't have access to healthcare in the way we do. So it's a really good point to kind of support that as much as possible, to be able to make sure that people keep getting the healthcare gets better and better, basically.
Yeah, absolutely.
So what about you? What's next for you? Have you got anything in the pipeline that you're working on, or anything you kind of want to do in the future?
So the paperback is out in January, which is very exciting. I'm sure there'll be a few more events and interviews and things around that. I've got ideas kind of like tinkering away in the back of my brain for book 2. But for the time being, I'm still, to be honest, kind of trying to catch my breath a little bit from the promo tour from this one. So yeah, back to freelancing, back to being a mum to a very chaotic toddler, and just trying to balance everything out. But yeah, definitely more in the pipeline. So watch this space.
Well, I mean, I highly recommend it to anybody that hasn't read it. We will put a link on it as well to obviously in the and also like some of the research stuff as well in the show notes.
Thank you.
But at the end of every episode, we ask everybody, so we ask all of our guests to describe their what the health tech moment. So this is, any weird, wonderful, emotional, any kind of stories that you've experienced within the health and social care industry. So Sarah, what's your what the health tech moment that you'd like to share with us?
So I often say that I've been writing about these issues for so long that nothing really shocks me anymore. I've heard so many weird and horrifying and frankly quite awful things that doctors have said to patients. But the one that really had me picking my jaw up off the floor was a female doctor sent me a message saying that she'd been working in surgery with a male surgeon, and he said that he hated doing the endometriosis diagnostic surgeries because he said these women were all effing mental. And that just absolutely blew my mind in terms of, you know, how far we have to go. You know, this is the guy whose literal job is to cut women open to diagnose them with a condition that affects 1 in 10 people assigned female at birth. And before before they had even gone under anaesthetic, he'd written them off as mental, you know, that it was all in their heads. So that, I think, for me, really kind of sums up so much of what the book is all about, and the journey that we're on here, and why it's so important to keep talking out about all of these issues.
And I think hearing that as well absolutely backs up exactly what you've mentioned, what the book is about, and actually, you know, get into that higher level and making, you know, people realise that these are actually issues and not something that is in someone's head. So I think that absolutely sums up everything that we've kind of discussed about speaking up and things like that as well today. So thank you very much for sharing that with us.
Thank you.
Thank you so much for joining us this week, Sarah. It's been brilliant to chat to you about the book. And as I mentioned earlier, you know, I will put a link on it to it in the show notes. Thank you to everybody for listening. Join us in a couple of weeks for another brand new episode. And don't forget to rate and subscribe. And if you have any questions for us or any of our guests, please email whatthehealthtech@radarhealthcare.com.